Stroke warning. 7 silent morning habits seniors must change now. Have you ever walked from your bedroom to the kitchen, completely unaware that your brain might have just experienced a silent stroke precursor? Every single morning, 8 out of 10 seniors experience this. And tonight, I will demonstrate how you can safeguard your brain starting tomorrow. I am Dr. Bill Harrison, a neurologist and stroke specialist. And what I am about to reveal may surprise you. The common morning routines that many consider to be entirely normal and even beneficial are subtly preparing their minds for setbacks. As you brush your teeth and prepare your coffee, your blood pressure rises, your arteries become less flexible, and your brain fights to receive the oxygen it urgently requires. What you are about to learn has assisted numerous individuals in changing their mornings from potential stroke risks to strong defenses for brain health. If you're 60 or older and wish to maintain your independence, memory, and quality of life, go ahead and subscribe for inspired living today. Today, we will explore 7 prevalent morning habits that may be increasing stroke risk in adults age 60 and above. Additionally, I will provide you with a precise morning routine that can significantly reduce your risk by as much as 50%. First, I want to share an experience from my emergency room 3 weeks ago that transformed my perspective on morning routines for good. Margaret entered my ER at 8:30 on a Tuesday morning. At 67, she is a retired teacher who practices yoga 3 times a week and adheres strictly to her medication regimen, embodying the qualities of someone who prioritizes her well-being. However, that morning, she fell to the floor in her kitchen while preparing breakfast. Her husband discovered her on the floor disoriented, struggling to articulate her thoughts, with her right arm entirely weakened. When the ambulance finally arrived, most of her symptoms had subsided, but I was fully aware of what had transpired. She experienced what is referred to as a transient ischemic attack, known as a TIA, which is a mini-stroke. What truly unsettled me was when I requested Margaret to detail her precise morning routine. She outlined 7 habits that countless seniors engage in daily, believing they pose no risk. By altering these 7 morning habits, Margaret has not experienced any neurological episodes in the past 3 months. Before I share what those habits were, it's important for you to grasp why the first hour after waking is the most critical time for your brain. Many individuals overlook the significance of timing when it comes to strokes. A stroke doesn't occur randomly at 3 in the afternoon. It is a result of specific underlying factors. A study conducted by the American Heart Association, 2023, on stroke timing data indicates that strokes are most prevalent between 6 a.m. and 10 a.m., particularly peaking during the initial 2 hours after waking. The transition from sleep to consciousness is when your brain is at its most vulnerable. At night, there is a natural decrease in blood pressure, a reduction in heart rate, and a slight increase in blood thickness. Upon waking, your body must quickly adapt circulation, blood pressure, and oxygen delivery to fulfill the requirements of being awake. For older adults with less flexible blood vessels, this morning increase can strain the brain's sensitive blood supply. The 7 habits I'm going to share influence not only your emotions but also significantly alter the blood flow to your brain during this important morning shift. For individuals over 60, these seemingly harmless habits can transform a typical morning routine into a potential stroke risk. What was Margaret doing each morning that endangered her brain? Let's begin with the initial habit that is taking place in countless bedrooms at this moment. Habit number 1. Jumping out of bed as soon as you wake up. Margaret expressed her pride in being someone who efficiently utilizes her mornings. The alarm sounds. Feet touch the ground. The day starts. Does that ring a bell? What Margaret was unaware of was this: when you quickly transition from lying down to standing up, particularly after a long night of sleep, your blood pressure may decrease by 20 millimeters of mercury or more. That condition is known as orthostatic hypotension, and for a brief period of 15 seconds, your brain is deprived of adequate oxygen. On that initial step, you may experience a sensation of lightheadedness, narrowed vision, or unsteady legs. That brief moment isn't merely awkward. It's your brain signaling that it's having difficulty operating. The approach I refer to as the 90-second rule. Upon waking, spend 10 seconds taking deep breaths. followed by 20 seconds flexing your ankles and hands to promote circulation. Then, take 20 seconds to sit up slowly. And allow 40 seconds with your feet on the floor for your body to adjust before standing up. Margaret shared that this straightforward adjustment resolved the morning dizziness she had been facing for months. She believed it was merely the effects of aging. But it was truly her brain signaling for assistance. If you have experienced dizziness upon standing up in the morning, please type DIZZY in the comments. You are not isolated and your feelings are valid. Habit number 2. Bypassing water and going directly for coffee. Margaret prioritized her coffee above all else in her daily routine. However, what she failed to recognize was, following 7 or 8 hours of sleep, you find yourself approximately 1% dehydrated. Your blood is denser, circulation is slow, and when you factor in caffeine's ability to constrict blood vessels, you're setting the stage for complications. David, a 71-year-old patient, visited me due to experiencing a racing heart each morning following his first cup of coffee. Upon examining his hydration status, we found that his blood was excessively thick in the mornings, causing his heart to exert extra effort to circulate it through his arteries. The solution is straightforward yet impactful. Consume 8 ounces, which is 240 milliliters of water at room temperature prior to any caffeine intake. Incorporate a 1/4 teaspoon of lemon juice or a small pinch of sea salt to enhance absorption speed. David's morning heart racing ceased within a week. Habit number 3. Consuming nutritious breakfast options that contain 400 to 600 milligrams of sodium. Margaret believed she was making healthy choices with her instant oatmeal and whole grain toast. What she was unaware of is that these seemingly harmless foods were providing a significant amount of sodium that was hardening her arteries before they even had the opportunity to adjust. Instant oats, bran muffins, deli turkey, and even protein breads can contain 300 to 400 milligrams of sodium in each serving. Combine several of these and you'll reach 600 milligrams before 9 a.m. The additional pressure directly affects the microvessels in your brain. Sarah, who is 73 years old, recorded blood pressure readings of 140/90 within 30 minutes after having breakfast. After we replaced her flavored instant oatmeal with plain rolled oats and berries, her morning blood pressure decreased by 20 points. Try to keep your sodium intake at 300 milligrams or below before 9 a.m. Emphasize a diet consisting of a majority of vegetables and fruits, complemented by a smaller portion of complex carbohydrates and protein. Habit number 4. Consuming black coffee before eating anything. Margaret was sipping 2 large mugs of coffee on an empty stomach, believing it would provide her with the energy she needed for the day. Instead, it was causing a 30 to 60% increase in adrenaline that was leading to artery constriction and a rapid pulse. Thomas, 69 years old, visited my 3 times, believing he was experiencing heart attacks. But it turned out to be acid reflux caused by coffee. The answer isn't to eliminate coffee. It's to have a buffer bite beforehand, half a banana, 5 almonds, or a boiled egg. Limit your coffee to 1 mug, approximately 150 milligrams of caffeine, and allow a 30-minute interval before considering a refill. Habit number 5. Which frightens me the most? Dismissing mild morning dizziness, slurred speech, or numb fingers. Margaret mentioned that she experiences instances where her words don't come out correctly. Typically during the first hour after waking up, she assumed it was merely a result of being groggy. These symptoms are not just grogginess. They are transient ischemic attacks, TIAs, serving as your brain's warning sign for an impending stroke, typically occurring 12 to 24 hours in advance. Any speech issues that resolve in under 10 minutes. Any weakness in grip on one side. Any drooping of the face. These are urgent medical situations. Keep in mind the quick assessment: facial drooping, arm weakness, speech difficulties, and if you notice these signs, it's time to call for emergency help. Regardless of whether symptoms disappear, make sure to record the date, time, and details of the occurrence and reach out to your doctor without delay. Margaret's morning speech difficulties were, in fact, several strokes signaling that a significant one was imminent. Overlooking them might have resulted in losing everything. Habit number 6. Taking all your morning pills at once, occasionally accompanied by coffee. Margaret was taking her blood pressure medication, thyroid pill, and aspirin simultaneously with her first cup of coffee. She was unaware that this combination was leading to hazardous interactions. Caffeine can lead to significant fluctuations in blood pressure when taken with medications. For instance, the combination of green tea and beta blockers may lead to a significant decrease in blood pressure, potentially reaching unsafe levels. Ruth, who is 75 years old, recorded readings below 100/60 an hour after she took her morning medications with coffee. In Step 5, it's important to share this information with family or a close friend so they can also recognize warning signs. Stroke symptoms may not always be obvious, and having someone who understands what to observe can be crucial for your safety. Utilize a medication organizer equipped with alarms. Review all labels for guidance, such as whether to take with food or to steer clear of caffeine. Ensure there is a minimum of 30 minutes between the use of interacting drugs. Your medications are intended to safeguard your health, but they will only be effective if taken as prescribed. Gradual, steady adjustments are more effective than large, impractical transformations. Your mind will recognize the change first, followed by your energy levels, and then your assurance that you are genuinely safeguarding your most valuable asset. The morning routine you adopt tomorrow will either safeguard your brain or jeopardize it. There is no middle ground regarding stroke prevention after the age of 60. If this video has assisted you in recognizing even a single risky morning habit, please click the like button and share it with someone over 60 who could benefit from this information. Join Inspired Living for additional strategies to safeguard your brain. Take a moment to stop. Choose one habit you will alter starting tomorrow. Write its number below, and tag a friend to help them safeguard their mind as well. Your dedication has the potential to save 2 lives. Keep in mind that preventing strokes isn't about achieving perfection. It's essential to comprehend how your everyday decisions influence your brain health. Your level of control is greater than you realize, beginning with how you utilize your first hour after waking up. This information is provided solely for educational purposes and should not be considered a substitute for professional medical advice. It is important to speak with your healthcare provider prior to altering your medication schedule, or if you notice any troubling symptoms. Keep in mind this essential principle: safeguard your mornings. Safeguard your mind. Habit number 7. Remaining in bed. Mindlessly scrolling on your phone while disregarding the urge of a full bladder. Margaret acknowledged that she enjoyed checking her emails and the news before getting out of bed. Even when she had to use the bathroom, she believed that keeping it for a little while longer was inconsequential. Frank, who is 68 years old, experienced sudden pounding heartbeats each morning when he finally got up to use the bathroom. Make your way to the bathroom shortly after waking up. If you find yourself waking up more than twice during the night, consider reducing fluid intake 2 hours prior to bedtime and consult your doctor regarding any prostate concerns or the timing of diuretics. Please take a moment to evaluate yourself briefly. Here are 5 warning signs that your morning habits could be impacting your brain. Count how many apply to you and share that number in the comments below. Firstly, experiencing a head rush or tunnel vision upon standing up in the morning. Secondly, experiencing a racing or fluttering heart after your initial sip of coffee. Thirdly, blood pressure readings exceeding 140/90 within 30 minutes after breakfast. Fourth, any speech difficulties, weak grip, or numbness that persists for under 10 minutes. Number 5, an unexpected rapid heartbeat when you finally rise from bed. How many of these warning signs do you encounter? Please provide your thoughts on the number below. If you identify 2 or more, your morning routine may be jeopardizing your cognitive health. But the positive aspect is that we can address this beginning tomorrow. Recall Margaret, who fell in her kitchen that Tuesday morning, half a year after starting what I refer to as the stroke-safe morning routine. She shared something with me that sent chills down my spine. She said, "Doctor, I wake up feeling as if my mind is truly prepared for the day ahead. The fog has lifted, the dizziness has disappeared, and I feel more alert than I have in years." This is precisely what Margaret currently practices and what I suggest to all my patients aged 60 and above. First, prepare everything the night before. Place a glass of water, your pill organizer, and low-sodium breakfast items on the counter. In the morning, your mind may not be at its sharpest. So eliminate uncertainty. Next, proceed with the 90-second wake-up progression. Take deep breaths. Move gently. Sit up slowly. Pause with your feet on the floor. And then stand up. This allows your cardiovascular system to adapt in a safe manner. First, hydrate. Next, consume a small amount of protein. Finally, enjoy your caffeine. Following this precise sequence, start with water to promote circulation. Follow with food to mitigate caffeine's impact. And then enjoy coffee for a gentle boost of energy. In the fourth step, record your blood pressure along with any unusual symptoms for a duration of 1 week. Patterns hold greater significance than individual figures, and you'll begin to understand precisely how your morning decisions influence your mind.